Imagine taking a laser capable of vaporizing solid material, right? The kind of intense, focused light that you probably associate with cutting tools or, I don't know, sci-fi weaponry.
Oh, yeah, a high-powered, true surgical tool.
Exactly. Now imagine taking that laser and firing it directly at human tissue that has become thinner, drier, and more fragile than wet paper.
It sounds like a total disaster.
It really does. Logically, it should just instantly destroy whatever is left. But today we are looking at a medical paradox. We are exploring how the literal physical physics of human aging are forcing doctors to completely rewrite the rulebook on how medical lasers operate.
It's really a complete paradigm shift because for decades, surgery has used lasers primarily to cut, right? To ablate or basically destroy diseased tissue.
Right.
But what we're seeing in the sources today is a manipulation of core quantum physics. They're bending the behavior of light to coax the body into healing itself. And they're doing this specifically by adapting to the change in biological state of the patient.
And the focus for today's deep dive is highly specific and, honestly, incredibly fascinating. We are pulling together clinical trial protocols, medical journals, and clinic data to answer one central question.
Which is a question of pure physics, really.
Right. We want to know how the severe physical dryness of a postmenopausal vaginal wall actually alters its thermal relaxation time. And how does that altered physics force doctors to fundamentally change the pulse duration of erbium YAG lasers to treat it safely?
I mean, this intersection of quantum physics, optics, and human biology is just incredibly elegant. It really validates why you, or anyone listening, would be curious about this.
Okay, let's unpack this. To understand why the laser actually needs to change, we have to look at the biological canvas we're firing that laser at.
The canvas dictates everything. You can't just ignore the tissue.
Exactly. Because the tissue itself is changing as we age, which changes the whole rules of engagement.
So the condition we are looking at is genitourinary syndrome of menopause, or GSM.
Right, which people might know by another name.
Yeah, in older medical literature, you'll often see this referred to as vaginal atrophy. But GSM is a much more accurate umbrella term
Why is that?
because it encompasses a massive cascade of structural and functional changes in the tissue, and it's driven entirely by a drop in estrogen.
Right, so estrogen is doing a lot of heavy lifting behind the scenes here. It's not just, floating around doing nothing. It's actively maintaining the architecture of that specific environment.
It really is the master architect. I mean, estrogen maintains the structural integrity, it maintains the blood flow, and crucially, the moisture of the vaginal ecosystem.
So what happens when that drops?
Well, when the body's production of estrogen plummets, whether that's just a natural result of menopause, or maybe it's induced by certain breast cancer treatments, pelvic radiation, or even the surgical removal of ovaries, that entire ecosystem just collapses.
Wow.
Yeah. The vaginal lining in a healthy premenopausal state is thick.
Yeah.
It's highly elastic, and it is naturally moist due to constant cellular turnover and healthy blood flow.
But without the estrogen.
Without estrogen, the tissue becomes remarkably thin, the elasticity vanishes, the friction threshold drops to near zero. And crucially, for the physics of our laser discussion today, it loses almost all of its natural moisture.
It just dries out.
Exactly. It becomes severely dehydrated.
Think of it like a lush, thick kitchen sponge that you just left out in the baking sun for 3 days. It shrinks, it becomes brittle, it turns super stiff.
That's a great way to picture it.
Yeah, and if you take that dry sponge and try to wring it out or apply the same physical force to it that you easily applied when it was soaking wet, that dry sponge is just going to tear and crumble.
Right. The mechanical tolerance of the tissue completely changes. And for the millions of people experiencing GSM, this isn't some abstract cellular change.
No, it's very real.
This thinning and drying out translates to painful intercourse, chronic irritation, urinary incontinence, recurrent urinary tract infections, and just a devastating drop in overall quality of life.
Because the tissue is quite literally tearing. It just lacks the moisture and the collagen to stretch.
Exactly. So the goal of medical intervention here, specifically using laser thermotherapy, is to trigger neocollagenesis.
So wait, we aren't just trying to patch the tissue up or manage the pain with temporary creams, right? We're trying to force the body to build brand new collagen from scratch.
We are trying to wake up the fibroblasts. Those are the cells responsible for building the structural framework of our tissues.
Okay, so how does heat do that?
By delivering very precise amounts of heat into the tissue walls, the laser stimulates those fibroblasts to produce new collagen and new ground substance components.
Round substance
Yeah,
component.
basically the gel-like matrix that holds water in the tissue. So the ultimate goal is to structurally reverse engineer the tissue back to a healthy, resilient, premenopausal state.
But this brings us to a massive logical hurdle,
Hmm.
because we have a tissue that resembles a dry, brittle sponge. And when I hear the word laser, I think of a continuous, highly concentrated beam of intense light.
Right, like a lightsaber or something.
Yeah. So firing that into a dry, fragile environment seems completely contradictory. Sounds like you just set it on fire.
To understand how doctors avoid causing massive damage, we have to look at a foundational concept in laser physics called selective photothermolysis.
Selective photothermolysis.
Okay. Medical lasers don't just act like a blowtorch. They don't indiscriminately burn everything in their path. They are highly calibrated instruments designed to seek out and target specific materials within human tissue.
And what are those targets called?
We call these targets chromophores.
So chromophore is just a part of a molecule that absorbs a specific wavelength of light.
Exactly.
Like, for you listening, think about how wearing a black shirt on a sunny day absorbs all the light and makes you really hot, while a white shirt reflects it.
That's a perfect analogy. In dermatology, for example, if a doctor wants to remove a dark sunspot, they tune the laser to target the chromophore melanin.
So the laser passes right through the normal skin.
Exactly. It passes harmlessly through the lighter skin and only heats up and destroys the dark melanin pigment.
Oh, that makes sense.
Or if they are treating a spider vein, the laser is tuned to target hemoglobin. It heats up the blood inside the vein until it collapses, leaving the surrounding skin alone.
But wait, vaginal mucosa is minimally pigmented. There isn't an abundance of melanin or anything to target.
Right. So to get energy into this specific tissue, the target chromophore has to be water.
Ah, the laser is hunting for water molecules. It uses the water inside the cells to absorb the light and convert that light into heat.
Which brings us to the most critical variable in this entire biological equation: thermal relaxation time.
Thermal relaxation time. Let's break that down.
Whenever you heat up a target, whether it's a water molecule in a cell or, say, a pan on a stove, that heat doesn't stay contained forever.
It eventually bleeds out into the surrounding environment.
Exactly. Thermal relaxation time is the exact measurement of how long it takes for a target's temperature to drop by 50% after being struck by a laser pulse.
It's like the tissue's thermal exhaust system.
Yes, that's exactly what it is.
If you blast a cell with heat, the thermal relaxation time is the tiny window you have before that cell overheats and essentially melts into the healthy cells next door.
And the golden rule of all medical lasers is built entirely around this concept.
What's the rule?
To confine the thermal damage strictly to your intended target and prevent a catastrophic burn to the surrounding healthy tissue, the duration of your laser pulse must be less than or equal to the target's thermal relaxation time.
So you have to get in and get out.
Exactly. You have to deliver the energy, create the heat, and shut the laser off before the heat has a chance to bleed outward.
Wait. If the golden rule relies on targeting water and measuring how fast that water cools down, but GSM inherently means the vaginal tissue is incredibly thin and almost completely devoid of water,
Right.
then doesn't that completely mess up the math? Like, if the water is gone, the tissue's thermal relaxation time has to be drastically altered.
Right.
Doesn't the laser just instantly fry the dry, fragile tissue on the surface instead of safely heating it?
This raises an important question, and it is the exact physical dilemma that forced researchers into a corner.
I can imagine.
You cannot just dial up a standard laser setting and fire it at GSM tissue. The physics just won't allow it.
Let's look at the primary tool they're trying to use here, the erbium.YAG laser, or RYAG for short.
Right, there are different types of lasers in this field.
Like the CO2 laser, right, which tends to cause a bit of surface vaporization while radiating a lot of heat deeper into the tissue with each pass.
Exactly. But the RYAG laser is a different beast entirely. It has an incredibly high absorption rate in water, much higher than CO2.
So it's really thirsty for water.
Yes, it's what's known in the industry as a true ablative laser.
Okay, an ablative laser is designed to vaporize tissue upon impact, right?
Yes, a standard RYA pulse hits the water in the tissue, instantly flashes that water into steam, and physically blasts away a microscopic layer of tissue.
Like, how deep are we talking?
Usually about 5 to 20 micrometers deep per pulse. It is a highly precise cutting tool.
But if we fire a standard short ablative pulse at a GSM patient's vaginal wall, We are aiming a vaporization tool at tissue that is already dangerously thin.
Exactly.
And because there is so little water to absorb the energy and the thermal relaxation time is totally altered by that dryness, the heat can't dissipate normally through the tissue's exhaust system.
If it has nowhere to
So
go.
you end up ablating and destroying tissue that you desperately need to preserve.
It would be a catastrophic clinical error. You are attempting to rebuild the structural integrity of the mucosa, not vaporize the tiny, fragile fraction of it that remains.
It's like trying to boil water in a pot that has completely boiled dry. When the water is gone, the heat from the stove has no one to disperse, doesn't travel through a liquid medium, it just violently scorches the metal of the pot itself.
That's spot on. The researchers had to figure out how to deliver enough thermal energy to wake up those fibroblasts and trigger neocollagenesis without scorching the empty pot.
But they couldn't just magically add water back into the tissue beforehand.
Right. No, because the severe dehydration was the underlying pathology they were trying to cure.
Right, of course.
So, since they couldn't alter the physical state of the tissue, they had to alter the physics of the light. They manipulated time itself.
Oh, wow.
They changed the pulse duration.
And reading through the clinical protocols, this is where they detail the solution. The Irwai-Gi smooth mode.
The smooth mode is a brilliant circumvention of standard laser physics.
How does it work?
Instead of firing one aggressive microsecond-long blast of concentrated energy, which would instantly vaporize the dry surface, they extended the overall pulse duration out to a massive 250 milliseconds.
Like 250 milliseconds might sound like the blink of an eye to us.
It does.
But in the realm of quantum physics and laser optics, where standard pulses are measured in millionths or billionths of a second, a quarter of a second is an absolute eternity.
It is a radically long exposure time, but they aren't firing one continuous beam for that entire duration.
Oh, because if they did, they would just drill a hole straight through the tissue.
Exactly. Instead, this extended pulse is actually a rapid-fire sequence of microscopic super pulses.
Super pulses.
Yeah. Each individual burst of light lasts for a mere 300 microseconds. And the genius part is what happens between those bursts.
The resting phase.
Right. The laser intentionally shuts off and rests for 50 milliseconds before firing the next 300 microsecond burst.
So they were firing a tiny sliver of heat, hitting the brakes, firing another sliver, hitting the brakes again. They are stacking these microscopic thermal impacts on top of each other over a long period of time.
Yes. By stretching the energy out and enforcing these 50 millisecond rest periods, they are perfectly adapting to the dry tissue's altered thermal relaxation time.
That makes so much sense.
That tiny 50 millisecond pause is just enough time for the dry, fragile surface mucosa to cool down, preventing it from crossing the threshold into vaporization.
But while the surface is cooling, the deeper layers of tissue, right, the lamina propria, which has a longer thermal relaxation time, those deeper layers begin to trap and accumulate that heat. Here's where it gets really interesting. Because the literal lack of water explicitly dictates this chosen depth and pulse setting.
Right.
The doctors aren't fighting the dryness. They are using the tissue's own dryness as a physical parameter to push the healing heat deeper into the tissue walls without breaking the surface tension.
The superficial dryness becomes a protective barrier. It's almost like a thermal shield, forcing the energy downward.
Wow.
By staggering the pulses, the temperature of the deeper mucosa safely rises to exactly 60 to 65 degrees Celsius.
And why that specific temperature?
Because this is the biological sweet spot. The heat penetrates roughly 500 to 1,000 micrometers deep into the tissue walls, bypassing the fragile surface entirely. When the deeper tissue hits that 60-degree mark, it triggers the Joule effect.
The Joule effect. So that is a photothermal reaction, right?
Yeah.
It's the moment the light energy converts into a physical heat reaction that the body is forced to respond to.
Exactly. That sudden spike in deep tissue heat tricks the body into thinking it has sustained a mild, controlled injury.
And that triggers a whole cascade of events.
Right, a phenomenon called thermal reperfusion. The body basically sounds a massive chemical alarm. The local temperature rise causes the immediate release of bradykinin and various histamines,
Which are the body's emergency chemical messengers. For you listening, when bradykinin is released, it physically forces the local blood vessels to dilate, opening the floodgates.
The precapillary sphincters relax, and you get an immediate, massive rush of fresh blood flow, oxygen, and nutrients flooding into the deep tissue.
And that's what we want, right?
Yes. This is what provides the raw materials for the fibroblasts to start manufacturing new, healthy, moisture-rich collagen, all while leaving the delicate, dry surface completely unburned and intact.
It is an incredible manipulation of biology through physics. The timing of the light tricks the body into a massive healing response deep below the surface.
It's really elegant.
It is. But as we dug deeper into the sources, we found a clinical trial that takes this relationship between tissue hydration and laser physics to an entirely different, almost counterintuitive extreme.
Oh, this study is fascinating.
Right. If the natural dryness of GSM tissue naturally forces the laser's heat deeper, what happens if scientists intentionally dehydrate the tissue themselves to control exactly where the laser goes?
This experiment fundamentally proves how critical hydration is to laser penetration.
So what were they trying to treat in this experiment?
The researchers were tackling a different but often related condition, female stress urinary incontinence, or SUI.
Okay, and the anatomy involved in SUI requires a totally different approach, right?
Yes. The goal here is to use the heat of the laser to shrink and tighten a specific layer of connective tissue called the endopelvic fascia. It basically acts like a supportive hammock for the bladder.
But the endopelvic fascia is buried deep. Like, to get the laser's heat to that connective tissue sling, the light has to pass completely through the vaginal wall first.
And as we just established, the vaginal wall is designed to absorb the ERYAG laser's energy.
Right.
Even using the stacked pulses of the smooth mode, a significant portion of the heat is going to be trapped in the vaginal wall. But for treating urinary incontinence, they don't just want to heat the wall. They need the bulk of the thermal energy to completely bypass the mucosa and hit the deep fascia underneath.
So how did they test this?
They set up an ex vivo experiment. They used porcine vaginal tissue, pig tissue, which is standard in medical physics testing because its structural density and water content are remarkably similar to human tissue.
Makes sense.
They needed to figure out a way to make the vaginal wall completely transparent to the laser.
So the light would pass straight through it without heating it up.
Exactly. To do this, they used an optical clearing agent, or OCA.
And the agent they chose was 100% pure glycerol.
Yes. They applied this topical glycerol directly to the porcine vaginal wall and left it to sit for 30 minutes. Now, pure glycerol is a highly oversaturated solution.
So when it sits on the tissue, osmosis takes over.
Right. The glycerol acts like a powerful molecular sponge. It physically draws the water molecules out of the surrounding cells. They intentionally severely dehydrated the vaginal wall.
They took a healthy, hydrated piece of tissue and chemically turned it into that dry, brittle sponge we talked about earlier.
And the physical transformation of the tissue was drastic. By sucking the water out, the tissue actually shrank in thickness, and the cellular components became densely packed and highly ordered.
But the most important change was to its optical properties, right?
Absolutely, because the primary target for the ERIAG laser, the water, was now gone from the surface tissue. They achieved a massive 61% increase in optical transmission.
Okay, so what does this all mean? By chemically drying out the tissue, they essentially turned an opaque biological wall into a clear glass window for the laser to shine through.
Exactly. And when they fired the laser at the glycerol-treated tissue, the results were stunning. The total energy absorbed by the vaginal wall dropped from 62% down to just 50%.
Wow.
Because the surface couldn't absorb the light, the energy was forced to travel deeper. The energy deposited into the target deep fascia layer increased dramatically to 49%.
So they pushed it way deeper.
By intentionally dehydrating the surface, they increased the effective treatment depth by a full 0.5 millimeter, pushing the heat up to 3 millimeters deep into the fascia while completely preserving the surface mucosa.
It is wild to think that by simply taking away water, they can steer a beam of light deeper into the body.
It's incredible control over the physics.
But looking at the clinic FAQs in our source stack, specifically the Women's Health Clinic guidelines, I have to wonder if this glycerol experiment is too simplistic.
How do you mean?
Well, doesn't the clinic source explicitly warn that you cannot predict treatment depth or safety purely from hydration levels alone? I mean, the pig tissue in a lab is a perfectly controlled environment, but the human body is totally chaotic.
You're absolutely right to point that out. The clinical guidelines are vital context here.
Yeah.
The experiment proves the underlying physics, right? That water content dictates energy absorption. But the Women's Health Clinic source provides the clinical reality check.
Which is that we aren't just equations.
Exactly. They explicitly state that while mucosal water content heavily influences how YAAG energy interacts with tissue, you cannot reduce patient treatment to a simple math equation. They say, and I quote, "Tissue response is not decided by one mechanism, one setting, or one moisture measurement."
Because when you are treating a living, breathing patient with GSM, you aren't just dealing with water. You have varying degrees of blood flow, you have different cellular densities, maybe some scar tissue, and the totally unique pathology of their specific estrogen drop.
Human biology is endlessly complex. A doctor cannot just apply a moisture meter to the vaginal wall, read the dehydration level, and let a computer algorithm dictate the laser's pulse duration.
It's not a one-size-fits-all thing.
No, not at all. The depth of penetration, the heat accumulation, and the spacing of those micropulses must always be clinician-controlled and device-specific.
So the physics of thermal relaxation time provide the roadmap,
Yes.
allowing us to understand why the smooth mode works. But navigating that map requires intense medical judgment and a deep understanding of how that specific patient's tissue is going to react to a sudden, massive influx of thermal energy.
Beautifully said.
So to pull all of these threads together for you listening, when a patient experiences a drop in estrogen, their tissue loses its structural integrity and its water.
Right.
This severe, literal physical dryness completely alters the thermal relaxation time of the vaginal wall, meaning it can no longer safely absorb and disperse heat. If doctors were to use standard rapid laser pulses, the energy would violently ablate and destroy a surface that is already dangerously fragile.
Which is what we want to avoid.
So to heal this tissue without vaporizing it, medical science had to outsmart the physics. They do this by stretching the laser's pulse duration into an erbium. YA smooth mode, breaking the energy into rapid-fire microscopic bursts separated by 50-millisecond rest periods.
The pauses are key.
Right. This perfectly timed delay forces the heat to bypass the dry, fragile surface, accumulating only in the deeper tissue to trigger a massive chemical alarm that rebuilds new collagen from the inside out.
If we connect this to the bigger picture, we have just spent this entire deep dive exploring how a subtle drop in our body's natural water content fundamentally alters the way our biological tissues absorb high-tech, concentrated energy.
It really does.
And it really makes you wonder about our day-to-day lives.
Like what?
Well, if aging and internal hydration so radically dictate the literal quantum physics of how medical lasers penetrate our bodies, how might our daily hydration levels be subtly altering our interactions with everyday environmental energies?
Oh, wow. I didn't even think of that.
Right. Like, how does being just slightly dehydrated change the way our cellular structures absorb ambient UV rays on a sunny afternoon? Or even how the delicate tissues in our eyes and face absorb and process the light radiating from the screens we stare into for hours on end, entirely without our realization?
That is exactly the kind of question that changes how you look at the world around you. The canvas of our body is constantly changing, and every subtle shift changes how we physically absorb the environment we live in. I'm definitely going to be thinking about my own thermal relaxation time next time I forget to drink enough water.
It's definitely.
Thank you so much for joining us on this deep dive. Keep asking questions, keep looking for the connections, and we will catch you on the next one.